Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hi everyone, Dr. Shook here. I hope you're doing well today. In today's podcast, what I want to talk to you guys about is why is it that doctors treat hormonal imbalances differently? Why doesn't everyone treat it the same way? So why is it when you go to your doctor, do they want to prescribe Synthroid, or let's say for a thyroid issue, okay, like Synthroid or levothyroxine, which are synthetic forms of thyroid hormone? And then why do other doctors, and you hear about other people saying that their doctors will prescribe them T4 and T3 combinations like desiccated thyroid hormones? You might hear brand names like Armour or Nature Thyroid, things like that. And then other people, why do they go to doctors and they don't recommend any medications, but instead they're having them utilize dietary and lifestyle approaches and then utilize nutritional supplementation? So what gives? Why is it that when you go from one doctor to the next that it's all different? Don't they treat everyone the same? Aren't they trained the same? And that's a common problem that people, I don't hear that question as much as I see the frustration with the differences and the lack of understanding of why it is that way. And so this is a really important step for you guys to empower yourself so that you can have a bit more control and understanding of what you're getting into when you go to see various doctors, and you can be better and more aware of the type of model that you're going to be going into and being exposed to. And you can also choose and decide what you think is the most appropriate model for you. So, all right, let's get into this. So why do doctors treat everyone differently? Why isn't it the same? Because quite frankly, a lot of people think if they go down the road, drive down the road, and they pull into a doctor's office and they make an appointment, that doctor is going to treat them the same as another doctor. Like the general practitioner is going to do the same thing for the thyroid that another doctor is going to do, and that there's no difference. And the reality is that's not the case at all. There are a lot of different levels of training. There are different preferences, and all of these things shape and mold the way that particular doctor will try and help you. And I guess there are three different primary models that I see in practice, okay? The conventional model is a model that most primary care physicians are going to practice. It's based on utilizing synthetic hormones. So let's use the thyroid. Now this could apply to any of your hormones, not just your thyroid hormone. But let's use thyroid hormone in particular, so as a good example, okay? So you go into a conventional medical doctor's office. You tell them, you're complaining of your low thyroid symptoms. They draw blood. They see that your TSH, they're usually going to use a limited number of markers. And that's okay. I'm not saying that that's wrong. I'm just saying that's this model. They'll look at the TSH in most cases. And if it's high, they'll say you need thyroid hormone replacement. And most of them will give you Synthroid, which is a synthetic T4, or levothyroxine, which is the generic version of Synthroid. It's also a synthetic T4. And that's how they're going to treat the problem. You're going to come back in 6 weeks or typically 6 months, and they're going to look at your TSH again and see if it's come down. If it has, problem solved in their mind. Even if you still have problems, they're going to say, well, that's not coming from the thyroid then, okay? And so there are strengths and weaknesses of these models. And I want to talk to you more about these, and we'll go into that in a little bit more detail. I just want to kind of highlight the potential approach, and then we'll kind of talk a little bit more about some of the strengths and weaknesses. So that's the conventional model. That's what the majority of people get. And quite frankly, if you're listening to this podcast, you may have been exposed to that model, and it may not be helping you. And that's one of the reasons you're listening to me, is to see if you can't figure out other ways to help yourself or other ideas on what you can do. So that's the first model. Now, the second model is more of the bioidentical hormone model. Okay, so you'll see this, a variety of different types of clinics will do this, but this is a model that actually has, the doctors are primarily using bioidentical hormones. So instead of using the synthetic hormones that they use in a conventional model, they use bioidentical. So that means they're going to use stuff like, if we're talking about the thyroid, they're going to use natural desiccated thyroid hormone, NDTs, okay? That might be Armour, it might be WP, it could be Thyroid, it could be compounded, right? So these are all things that they're going to utilize. And within that model, there are sub-models. So there are, some clinics will draw your blood and they'll look at your labs and they will treat you with a thyroid hormone replacement to get your levels up to what they think is normal for your age. And here's the thing, guys, like all of these models, none of these models, there's no standard, there's no guideline. It just is kind of up to their preference and what they think is best. Because you might not know this, but a lot of the labs, when you measure hormones, they have no upper limit because there's no consensus or agreement on what normal for a lot of these hormone levels are. It's really important that you understand this. So under that bioidentical model, one group of doctors or one clinic may recommend supplementing you with a hormone until they get you up to levels that they think are normal, okay, or normal for your age. You might get another scenario where you're in a clinic that does not even use the lab values. They'll just recommend and give you the thyroid hormone replacement or hormone replacement until they feel that your symptoms are improved, and for no regard for your actual hormone levels. And in the third model, which we might call the anti-aging model, doctors will give you and dose you at levels that they think are consistent with, when you're, what your levels would have been like when you were 18 or 20 years old, right? Very, very youthful peak levels. And they'll try to keep you there. They'll keep you there forever because that's their idea of anti-aging. And these are all different models. And if you don't understand where the doctors are coming from, then you have no idea what you're walking into. And the problem with this is that these models can be somewhat problematic. The third model, let's talk about the third model, and then we'll go back into kind of some of the problems, the strengths and weaknesses. The third model is really the functional endocrinology model, which is what I practice, which is a model that really seeks to look at the chemistry. Like it looks, really the thing that differentiates it for me is that it looks in much more detail at overall physiology. So if we're talking about the thyroid, we're talking about how is the entire process of hormone production. Is it working well? Are there physiological or biochemical breakdowns at any of the points of production, transportation of the hormone, sensitivity of the hormone at the cell, or detoxification of the hormone? So it's looking at the entire production and clearance cycle of the hormone. And it's really, to me, that's what I practice, because to me that's the goal, is working with the body as much as we possibly can and not forcing as much physiological change on it. It's really trying to figure out addressing what's going wrong and then getting out of the way and letting the body do its thing. Now, the problem is that if you look at all these models together, the synthetic model is very limited in its assessment of overall chemistry and what's really going wrong. Just looks at TSH and recommends a synthetic hormone. Some people don't do well with just T4 medications. They don't convert them well. So, there are a lot of limitations. It's limited. That model helps a lot of people, but it's very limited, and a lot of people don't do well with it. And it's not really getting to root cause of the problem. The bioidentical model, well, there's a lot of different philosophies there, right? There's the 3 sub-models. Those models can be problematic, I think, because for one thing, when you're talking about thyroid hormone, it's not as big of a problem as it is estrogens and testosterone, because there are a lot of unwanted side effects with those levels being higher than they really need to be. You've got to check metabolites and forms of the hormones to make sure that they're being cleared from the body appropriately. And when you're talking about the thyroid itself, you do have to be concerned with, really high levels of thyroid hormone that can create some issues. But that model is also it's looking at just pure replacement, right? It's not looking at physiological breakdowns. So if your thyroid is not putting out enough hormone, why is it not putting out enough hormone? That's the question I would ask from a functional endocrinology perspective. We're looking at why is the thyroid not making enough? Is there a signaling problem from, the brain and the pituitary gland, which ultimately they signal the thyroid to make the hormone? Is there Hashimoto's? Is there an autoimmune problem that's causing this destruction of the thyroid, resulting in hypothyroidism? And if so, what can we do to properly support or dampen that autoimmune process? Is there a problem with transportation? That's what I'm thinking. Is there a problem with transportation? Can you get it to the cells where it needs to be used? Once it gets to the cells of the body, is there a problem with sensitivity at the cell? Can the cell have normal sensitivity to it? Is there normal fatty acids status? Is there high levels of inflammation? Is there cortisol? Are there cortisol elevations? If so, these are all problems. And then can it be cleared out and eliminated? And if you have these problems, simply replacing the hormone is not addressing the physiological breakdown. It may help you, but it's not addressing the problem. So, I think that there's a time and place for all of it, obviously. But from my functional medicine perspective and the functional endocrinology perspective, we use dietary, lifestyle, and then temporary nutritional supplementation to try to help people. And that's something that I think, I want to share with you guys, these different models, because a lot of you don't realize you're walking into an office, and if they're treating you, they're using one of these models. So you need to really understand and have a better idea of what's going on so that you can be, a better partner with the doctors and make sure that that's the model that you want for yourself. So anyway, I appreciate you guys so much. I enjoy hanging out with you. I hope this has helped you to better understand some of the common issues and problems I see, and I look forward to talking to you guys again soon. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.